Okay, Richard. Thank you. So, welcome everybody. This is the first time we've met as this new People Scrutiny Committee. I'm Councillor Jane Burton, I'm chair of this committee. There are members of the councillors here tonight on the committee, and we're welcoming some new members to the committee. Councillor Waller, Councillor Cuthbertson, Councillor Mason, and we're welcoming back Councillor Runciman. Glad to have you back, Councillor. We've got Councillor Clark, Councillor Maroney is coming back, and Councillor Nichols, we're welcoming you as well. Thank you for coming. We've also got two executive members, Councillor Steels Walshaw and Councillor Bob Webb. We've got now, have I got, yes, we've got Martin Kelly, who's Corporate Director of Children and Education, Maxine Squire, Assistant Director of Education and Skills. Sarah Story's not here tonight, but has fed in to, I've spoken with her. Pauline Stutchfield, who's Director of Housing and Communities, and Peter Roderick, who's Director of Public Health. So thank you all very much for coming to this brand new committee, People Scrutiny Committee. And tonight we're going to be looking at the work plan and the unallocated items recommended from previous scrutiny committees. So this committee has been put together from committees that were in place prior to in May. And so we have a brand new committee. We've got quite a huge remit. But and tonight we're going to be able to together look through and decide what we think we need to look at in scrutiny or in a briefing or as a task and finish group, because the new scrutiny setup that we've decided to go with at the council, and that was a cross-party decision, was to have fewer committee meetings, but to have more in-depth briefings and task and finish groups, so that we really are looking into items rather than just having perhaps, papers coming here that don't need to come to here. So we can really get stuck in on some of the items that we all think are important. And we want input from all members and all directorates about what is important. So that's a brief introduction to this new committee and what's going on. So first on the agenda is apologies for absence. And I did have a note earlier from Councillor Nelson. She may try to join us, but she was unwell. So declarations of interest. At this point in the meeting, has anybody got any declarations of interest that they want to declare? No, good. There's no public participation this evening. But this meeting is being webcast. So the main business of the committee tonight is to look at the work plan. I was going to work through it item by item, but I think as Peter Roderick has to go leave earlier for prior commitment, it might be a good idea if we go through to the items that are covered by health. So just looking through here. So I'm looking at adult social care. Is that strategy? Is that something that covers?
No, it's not.
So no, it's not. Okay.
Sarah Story, Director of Adult Social Care, would need to cover that.
That's yeah, Sarah Story, and I've spoken with her about that. Could you point me to the
Chair, if I've got a list of the things that I've spotted in here from our area.
That would be great. Go ahead. Yeah.
Thanks. So, councillors, we have a number of things that have been on previous health, housing and adult social care scrutiny work plan to be scheduled into the future, which I wanted to take you through just to, I guess, sort of summarise what the point of the discussion would be and what the project is. The first you'll find is an item that's entitled Healthy Weight. The public health team are developing across the course of this year a new approach to healthy weight, which we're calling a compassionate approach to healthy weight. Part of this is reflecting the huge public health issue that what some people might label obesity is, and that's not just a UK or a York issue, that's a global issue, but starting to recognise some of the ways in which public health and other sort of health professionals in particular have talked about weight has sometimes been quite counterproductive, and actually particularly weight management as a whole pathway which takes you from the start of very brief advice services and sort of advice around diet and physical activity all the way through to what we call tier 4, which is bariatric surgery. Actually, the national approach is changing there. The National Institute for Health and Care Excellence are taking away a tiered approach and are moving into a much less formalized way of people being able to move up and down what used to be tiers of that approach. That means that both some of the language that we use around weight, some of our strategies and policies around weight, and particularly some of our commissioning around weight management is going to change, and we intend to put our resources in slightly different places than, for instance, commissioning formal organisations to carry out weight management services and provide units of activity in that area. Because of that, what I'd like to do is bring to the committee a bit of a plan for what that might look like, get the committee's input and involvement within that, and I guess endorsement really of a bit of a city approach to talking about healthy weight in a more kind and compassionate way, and really would like a bit of a sort of discussion before we take the decisions on that through the committee, so the committee can shape that. The second thing, and this is simpler to explain because we've had recent discussions on this, is the pharmaceutical needs assessment. So that has been through the Health and Housing Adult Social Care Committee a number of times, both in terms of the needs assessment, but also discussions more widely on provision of community pharmacy. The needs assessment will be out for consultation very soon, and we'd like to approve it. And also then there are ongoing community pharmacy issues around particular closures of pharmacies, which the committee might want to raise through scrutiny. So that's obviously on the list. You put on the list urgent care. Obviously, council doesn't provide urgent care in the city. It's provided through a mix of primary and hospital-based services, but of huge issue, sort of interest to residents. Certainly a bit of healthcare, which has been particularly challenged over the last few years. I know the committee have heard both from the hospital A&E department and Nimbus Care, who provide a lot of the out-of-hours work in the past, and my recollection is that was back in November, so committee members might want to call those particular health partners to committee to talk about that in the future. There is an item here which I wasn't aware of, and it'd be really helpful from my perspective to understand what we might look for from a discussion of healthcare and artificial intelligence. That's got itself onto the list, and be really happy to facilitate that discussion, but just keen to understand a little bit more exactly what was sought from that. And then I wanted, Chair, if it's okay, to put at least two other things potentially into the mix. One, I am quite keen on the committee discussing, which is the current changes to the structure of the NHS, particularly around the ICB. One of the regulations around health scrutiny is actually to oversee and to provide scrutiny on service changes within the NHS. It's a particular part of the scrutiny legislation. We're seeing some large-scale changes in the NHS structures locally and nationally, and the committee might wish to have a discussion on that. I'm aware you've had dentistry and oral health conversations over the years, and again, might be something that we want to keep on following up. The committee also may feel as if that has been discussed enough, and now it runs as it is. So, Chair, those are my sort of main thoughts, and happy to take questions, to take things back and develop a scope for all of those, or none of those, depending on which sort of what the committee chooses.
Okay, thank you very much. Any questions from the committee? Councillor Runciman.
Chair, I think where it's been indicated, and Peter, thank you for doing so, that a report could be ready at a certain time, we might take up the offer of taking it at that time.
Absolutely. I was going to come to that in that I've had preliminary discussions also with Sarah Story, and she indicated also that the adult social care strategy update would be ready in July, and I don't know whether the urgent care update would be ready by then, because I know that they came to the committee and it's saying here that it could be ready in July. And one of the things that I hope that we could do is that we can, as we did with the previous committee, rather than mix and match with different departments of the council, that if we go to, towards public health and adult social care in one meeting, and then housing in another, education in another. And I think that way we keep focused. And I don't know how people feel about doing it that way. Is it the general, am I seeing, yeah, Councillor Mason?
There's logic in that. I suppose the problem is that things will come up in different time frames and timelines. One thing I was wondering before we even start this was if there'd been any work with the exec done to kind of look at the forward plan, look at what decisions are coming up, trying to reconcile when things, particularly kind of pre-decision type scrutiny, how that all kind of fit together to form the bones of the absolute basics of everything.
Yes, in a preliminary fashion. So, but only in a preliminary way, because I wanted to get also what you feel as a committee as well. Because I don't want to impose my will on you. I want it to be a democratic process. So
I suppose just because that feels timely and that might not fit with the pattern of doing education in one meeting, health in another meeting.
It has worked in the past. I think Councillor Runciman will agree if it goes that way. I mean, we have had meetings where it has been, sort of one strand at the beginning, and then maybe if there are two sort of large items, rather than sometimes having three items. And don't forget, some of these items will be suitable for briefings as well, or task and finish groups too. So that, there are, I know, for instance, the government policy is all changing on that. So it might be that we have a task and finish group to look into what's going on so that that better informs people. So I think, I absolutely get what you're saying. And I think that's, very, very a good idea. But we'll try as best we can to work with when the reports are ready too, because we don't want to push for a report, which has been the case on some committees. And it comes, it's obviously they're not really ready to write that report. So it's not such a good report, but it would be better if the people writing it have enough time to do it, but also feel that, we want also to know what's going on. So, yeah, Councillor Rooney, Councillor Clark.
Yeah. Okay. Sorry, Chair, thank you very much. I'd just like to thank Peter for raising these. I think it was 6 areas you flagged, which I think is incredibly helpful for me and the committee. I just wonder whether looking at those areas, whether there is a rule to go through a briefing process first, because my experience on the committee has been that sometimes we have people come along who, to oversimplify, tell us how wonderful their service is. And we don't really have the background or the data to dig down into how that may reflect reality or not. So I just wonder whether there's a piece of work for the committee to address that, so that when we actually meet organisations or people, we're in a better position to ask key questions. Thank you.
That's a good point. I think, are you noting this? Yeah. Councillor Steels-Water, was that a supplementary?
It wasn't really a supplementary, but it was just to say it might be really useful to highlight which reports are statutory and have to come to committee. I was
Yes.
thinking along this because they obviously need to come. I think there's possibly more for adult social care than public health, but there are some reports within this that we absolutely have to have.
And I think, sorry, Reece, can you remember, you sent me an email earlier today
Yeah.
about the statutory. Sorry about this. You just hold on one moment.
Can read it out.
If you did, yes, if you could, that would be great.
Yes, there's only really one report I could find that was statutory, and that was the York Learning Annual Report, who has a statutory requirement to provide, in quotes, provide sound governance arrangements for the York Learning Services, and that's been done in the past by coming to scrutiny. There are other reports like the pharmaceutical needs assessment, which was statutory to be in place, but there isn't a mandate. It's not mandatory to necessarily come to scrutiny. It's just statutory for it to be in place. So there's only really one statutory report I found that has to come or has been coming to scrutiny in the past.
Okay, thank you.
Councillor Webb, sorry, I'll come to you, Councillor.
So
Sorry.
it's just on that point. Is it are officers in agreement that that is accurate, in the sense that I know in children's there are typically some reports that in the past have been they must come to scrutiny, and it's sort of within the constitution almost. And this isn't a discussion for now, but I would just like maybe in the background for officers to just check the list of all the things that before have come to children's scrutiny and health scrutiny, and just give us a definite list of things that have to go to different places. So yes, for example, the SACRE report, there is a statutory need for it to come to scrutiny, whether you like it or not, apparently. So that's one of the ones where I was under the impression that that had to come. But the other thing I would say is that there might be some statutory reports that could literally come for noting. So they come to scrutiny and you could read it, and if you have any questions, you contact officers outside of that meeting. But would you necessarily need to have a full-on debate and discussion about it there and then? That's just a question for me, but thank you.
Now, Councillor Clark and then Councillor Runciman, sorry. He's been very patiently waiting.
Thanks, Chair. Thanks, Peter. No, I mean, I was going to come back on that, and I know mentioned about the York Learning Annual Report having to come back to scrutiny, but does it have to come back to scrutiny, or is it something that can be received in a member's briefing? I think just on the Councillor Webb's points, and it would be a good idea, I think, to have an idea of what actually needs to come to scrutiny or what can be effectively noted via members' briefing. And that kind of leads me to my other point, or my main point really, which was to follow up on Councillor Moroney's point, and to some extent Councillor Mason's, and that was just about the areas that you've mentioned, Peter, whether there are areas that could be dealt with in a member's briefing, or whether you think there would be benefit in them coming to scrutiny. And I guess in the context of the forward plan, as Councillor Mason has said as well, and whether we can, effectively use what essentially are fewer scrutiny meetings over the course of this year anyway. Thanks.
Thanks. So to come back on that, Councillor Clark, I absolutely think there are. I mean, my suggestion would be, given a number of discussions in dentistry and oral health and pharmacies over the years, that we can keep on updating members on, for instance, the lie of the land in terms of pharmacy closure, some of the oral health successes that we've had over the years in terms of supervised toothbrushing through a briefing process, but perhaps doesn't need a continued paper sort of and conversation schedule. Whereas I would say that the ICB changes, and that is particularly timely. I would also say our conversation around healthy weight, because it's in a development phase, would really helpfully input before we get to a decision making. So I think there are probably a really good way of doing sort of half and half. The artificial intelligence discussion, I'm not entirely sure. I don't have an opinion on that at the moment because I'm not as sort of clear on what might be being asked for.
Okay, I'll let Councillor Runciman speak and then I'll have a.
I think we need to take careful cognizance of what has been done before. And I'd hate to see the pharmaceutical needs assessment pulled apart yet again, but I'd be really happy to have an update. And it may be that Reece might have to look at what has gone to both committees before and make sure we know that we're not chewing over something that's been chewed over rather thoroughly previously.
Yes, and I think one of the things that we did do in the previous committee was when we looked at dentistry, we did actually see some really good changes that came out of that meeting because of the way that they were assessing the need every 3 years rather than as a rolling thing. So we did actually have quite a good result from that. And I know when I spoke to Sarah Story as well, she mentioned the scrutiny of the proposed changes at the ICB and that they were very keen for us to feed into that, but we haven't had anything from them as yet. And I don't know if you know how imminent it is for them to have a report ready. I think Councillor Steele-Smallshaws might know.
I keep being told that it's been pushed back, and there was some report expected this week, but it was just very high level, and they're in a lot of meetings together, and being told that I will be updated when there's more available. But at the moment, there isn't anything to feed back on.
Yes, because looking at the schedule here, our next meeting is in July. And I had thought on what we had in here, if everyone agreed, that adult social care and the urgent care update might be suitable for that meeting. But obviously, I don't know, Peter, how imminent they want to reply to the paper on the new structure.
Thanks. I mean, Chair, this is a slightly sensitive topic, that one, because obviously, it's a restructure of an organisation in which there will be changes to staff roles, and I think we have to try to make sure that those public conversations are sensitive to that fact that staff roles are changing. My understanding is the time scale nationally, which is the same across all ICBs, is that May was the month in which, as an organisation, they were looking at the government's blueprint and coming up with essentially a new design and the new way that the ICB will function. June is the month in which that has been submitted back to regional teams, and they will be receiving feedback and making the final decisions. And July is the point of the process where they will start to be able to be more public, for instance, in the type of structure. At the moment, we know that the ICB function on a 6 and 5 type approach. So 5 sectors that they focus on: acute, community, primary care, and then the 6 is the 6 places, so that each local authorities. That's been their structure since they started. That is likely to not be what we end up with, and I would imagine the committee's probably might be most interested in saying, well, what it's not so much about the detail, is it, of individual functions, but actually what might the structure look like from an ICB perspective? Where's York's place in that? How do we make sure the voice of residents and our needs is really clear? And then there may be some aspects, particularly where there are interactions with council functions. The things that are named within the paper are SEND, continuing healthcare, safeguarding, infection prevention control, things like that. For the committee to have assurance that that is being taken into consideration, and that again residents will have a clear pathway for those things. July may be a point at which that's possible, but it would depend on the date, because I guess what you wouldn't want is for a committee to be discussing things that the staff and the ICB themselves haven't had time to digest. So what I can go and do is go and ask our current place director, Michael Ashton McMahon, when he feels that most useful time would be, and it may be that it needs to slip into either August or September.
The next meeting after that would be October.
Oh, right, okay.
So that
there we
all
go.
I could think of was that then we had that as a briefing paper.
Yes. Okay,
If and with comments then. Right, I've got Councillor Cuthbertson, Councillor Nichols, and then Councillor Waller. And Councillor, is it a supplementary? It's supplementary? Yes, so Councillor.
I just wanted to add on to those ICB changes and discussing about people's jobs and people's roles and stuff. I think what I've been really keen to look at, and if we could kind of look at it as how it is going to be affecting individuals, I think, in a sense, not looking at, because I think we're looking at the moment that it's not, people aren't going to experience these massive changes. And I think that sort of reassurance about how it was going to work on the ground at a level for people is what I'm really, really keen to discuss and keep aware of.
Thank you.
Yeah, thank you, Chair. It might or might not be right, but I understand that the NHS has to cut its costs at a local level by, I think it's 50%, and that's by September, if I remember rightly. Could we just have some clarity on that, because that does affect this, and I'm really worried that the NHS won't be able to adjust its financial strategies to fit with this target.
I mean, Chair, I can really briefly give the clarity on the details there. So the bit of the NHS which is being asked to make changes, well, there are three major changes. The first is NHS England nationally is being incorporated into the Department of Health and Social Care. Locally, each integrated care board has been asked for its running costs, so that the staff which run the ICB, to reduce in size by, on average, 50%. I think in Humber and North Yorkshire, it's something like 48%. They've been asked to essentially run the business of the ICB for £18.76 per head of population. And at the moment, the ICB locally runs it for something in the 30s per head of population. And then our hospital trusts have also been asked for their management to be reduced by approximately the same 50% ratio. So those are the three big changes. That isn't the money that's spent on providing NHS services. This is that commissioner provider split that has been there for 20 or 30 years. These are the people that allocate the resource. A much smaller bit of money pays for the people who allocate the resource. By far, most of the NHS spending, you'd imagine, goes on the providing of the resource, and that isn't affected by these changes. It's the commissioning side and the staff members who make decisions and also hold some other responsibilities which are closer to, I guess, that frontline thing. So the ICB has a role, currently a very strong role in safeguarding, a very strong role in SEND. So that it's not as simple as commissioner provider, but approximately that is the commissioner end, which is having to reduce.
Thank you, Chair. Just picking up on a couple of points made by members. There was a query early on about items that whether they have to come to scrutiny or not. So we will check whether any locally applied requirements in terms of things that have to come to scrutiny. But I think one thing that is quite important to point out is that Overview and Scrutiny is not a decision-making body, so it makes recommendations. And I think that's probably something that we need to be mindful about. In terms of the briefing sessions, one of the real kind of benefits of going with this approach is that the briefing sessions will help inform whether further scrutiny activity is required and at what level that we want to undertake that scrutiny activity. So if there's any doubt about how we want to proceed with that, that might be the best route. It may be, as a result of discussions with officers and executive members this evening, that there are areas that the committee feel quite strongly that they want to undertake more in-depth work, and then we can have a conversation about how we proceed with that. But I just thought that might be a kind of a useful overview of where we're up to at the moment.
Thank you, Chair. In terms of the impact on individuals, it is in terms of declarations of interest. I have declared that my partner works for NHS England and they are under the same situation as ICBs. My question relates to looking at it from the perspective of what residents experience. And whilst the architecture, regional architecture, is interesting, in particular to those people employed by it, but I think in terms of understanding what's actually happening on the ground and acting as a scrutineer of, is this right? And to highlight those disparities, particularly, there's a number of reports come forward and say, this part of the city is worse than that part of the city in terms of outcomes. Well, what's being done to address that? And what do these changes do in respect of addressing those disparities? So I don't want us to lose sight of the experience of your residents in health provision.
So be assured of those. Okay. Councillor Nichols, thank you for waiting.
No problem. It's more of a general point, but Peter's with first specific answer is that there's a lot on here we have to cut down to not a lot because we've got less of it, we've got more of these reports. So, and obviously I've never heard from you because I've not been on your committee. So the question I'd have is how much of these things do we actually influence and how many of the actual, we make a decision? Because obviously on children's, there's a lot of things where it's our, our councillors, our staff, our decisions, and we deliver. Whereas sounded like some of yours will influence weight loss, but we're not actually going to be directly in charge of weight loss. So when it comes to making the decision about what we're going to keep and what we're going to get rid of, I think from my point of view, it'd be what can we actually directly influence? And as Councillor Waller says, people's day-to-day lives, what can we actually make a difference as opposed to, well, we can give an opinion to ICB restructuring region, but they're not going to listen to us. If they've got the mind made up, we can make the strongest argument, the world's greatest thanks very much for your point of view, but we don't really care. So yes, we can influence, but I'd rather be more in the bits that you directly impact on people that we can directly influence, such as, like I said, a lot of the stuff that came to children's.
Actually, I think it's a really good distinction, actually, and I think it's why potentially, even though we know that, let's take the example of access to dentistry, even though we know from a resident's point of view, it's been very difficult over the last few years, and absolutely there is a role in terms of holding the NHS to account for the delivery of its services. It also leaves one with a slight sense that there aren't any council resources or officer time necessarily that we are able to dedicate directly to improving that delivery because we don't employ dentists, we don't, et cetera, et cetera. So I agree, and perhaps that's why some of the suggestions about some of that work coming through briefings so members are aware, members within individual wards know, their sort of local arrangements and what dentistry's accepting, what dentists are accepting NHS patients, that sort of thing, rather than necessarily additional scrutiny committees. I think on the weight thing, obviously that's a core part of sort of our public health work and statutory public health functions in terms of the improvement of the health of the population, which is one of the council's statutory duties. So I think that does offer us quite a good opportunity, but again, a really good point in that some of that will be to try and position the council and our small resources in this area well in a landscape which is changing and has lots of non-council services within it. And particularly one of the things that we are trying to adjust to is the fact that weight loss medication is rapidly changing, and actually it offers us a bit of an opportunity within public health to get a bit further upstream. We've almost in some ways felt a bit compelled to offer quite expensive one-on-one psychological interventions, and those have been funded for decades through public health. Actually, some of the new technology enables us to get into things like the food environment, food security, healthy food within our holiday activity fund programs, healthy food in schools, healthy food in lots of different situations, and physical activity, which is very much the council's remit because that's our public health stuff. So actually, I think it supports that moving away from always sort of asking the NHS to do things without any huge power to influence that into a what can we influence as a council.
Thank you, Chair. I just want, forgive me if this isn't the right part of the meeting, but I would like us to be able to celebrate good practice and successes as well. And without trying to put people on the spot in this room, we've got two people who've been heavily involved in turning around children's services. And I just wonder if there are generic lessons that we could all learn. Thank you.
My microphone's gonna. Yeah. So with the recent Ofsted report, which was outstanding in all 4 areas of children's services, you'd like to hear more about how the success happened. Yeah. I don't know if you'd like to come back at all at this point.
Yeah, I think we'd be very happy to bring something that describes the journey, perhaps in the last 2 years, both in terms of how we've shifted the quality of practice, but also the reduction in spend at the same time. So that I think we can bring something. We've been invited actually to Parliament to provide a seminar in Parliament. So we'll probably do something of a similar nature that we could bring here.
Yeah. So that would be excellent. Maybe as a briefing paper, well, not a briefing paper, but a briefing from officers to us as a group would be useful. Councillor Webb, you had your hand up.
Yeah, obviously I want that to be in front of the cameras. That's really positive. It's really good. And to make sure it gets in front of the cameras, the next part of that journey, of course, is the Children's Schools and Wellbeing Bill, if I've got that right, which would be the first time if I have. That really is going to shake up how social care in local authorities is delivered in children's services. So if we were doing something like that at the appropriate time, and I'm not saying that like this will be soon, but you know, after July, our next meeting's in October, for example, that would seem an extra little part to that would sort of help members understand where we go next. And again, I'm not putting a deadline of October, but you know, whenever the appropriate point was, because you know, the council authority is going to have to change how it delivers some services because of new statutory requirements. So that I think will be really valuable for members to hear about. Just in the interest of so maybe trying to move us along a little bit. For me, there's an item on there that is it says send update.
Mm-hmm.
And I think the one thing that sort of isn't on there is sort of the sort of from an exec point of view is at some point this year we will be looking at sort of the SEND strategy and the ADHD and autism strategies. Now they are things that, as Councillor Waller mentioned earlier on, that will affect people in this city, and as Councillor Nichols said, are things that we are writing. You know, it's our decision to make. So I think that sort of ticks both of those boxes as something that I feel should come to scrutiny, and I would like it to come to scrutiny before I have to sort of make a decision on it, really, because I think, you know, that makes things a much more open and transparent process. Now, that is something where if we do it sensitively and work with members of the community, you can have a really good debate, because we could get people from the community to come and talk as part of that, which would be quite helpful and I think quite valuable for the limited time that we have publicly. So for me, that is one where definitely I think those 2 items there are for scrutiny publicly in terms of what am I looking at as an exec member. On the other side of things, there is school attendance on that list. Now, that is one where We have influence within our school system, of course, but we don't directly run those schools. And that is one where I think you're in a good place to have a briefing on it, where potentially as members, we could sit down, have a briefing on it. And if anything came out of that where we went, oh, actually, you know, there's something that we really do need to take public, then fine, that's what would happen after that. But for me, I reckon that's where we need to go in my area. Obviously, we've already mentioned that the York Learning Annual Report has to come as a public item. Again, I would like to say that that could be published, but would we have to necessarily debate it and take a long time over it? And then we have the attainment gap item. The attainment gap item, I would say, is very similar to the school attendance item in that I think it warrants a briefing meeting. And then if things came out of it, you might then go, let's go to scrutiny. And then we have virtual school and the children's safeguarding report. Again, from my perspective, I would suggest it makes sense that they're briefing items. And then out of those, you might come forward and go, actually, what do we want to go public? So then you've got a clear steer of sorry, Councillor Waller, have you got something to say?
I was just listening to your directions to scrutiny.
Yeah. Thanks. So as I'm directing scrutiny here, I do think that there's an opportunity to put those, because it will be, the whole point is that we free up some meeting time to really tackle those issues that that we can have an influence over. And I think that's what I'm trying to get to. So I think that for me is the children's items covered off.
Enough again. So, Peter, you have to go quite soon, I think. So, I think we had Councillor Maroney and Councillor Mason wanted to speak. I don't know if they wanted to speak specific. No, you're okay. So it was Councillor Mason. Was it on to?
Can I make a quick point? Whilst I take all that Councillor Nicholl said about the individual person, and of course we must put the residents first, we need to remember the effect of scrutiny, which is public. And that rather follows on from what Councillor Webb was saying. If you get a service that suddenly finds it's coming to scrutiny and that discussion is going to be public, I'll just say socks can be pulled up, to put it at its simplest. So we need to bear that in mind.
Very first meeting of a very new way of dealing with it. There's batteries going. We're at the very beginning of our new process of scrutiny. So it's a learning process for all of us. So thank you for those comments. I think we've got enough from you, Peter, if you would like to go, I think we've all had enough input on the health, and we'll bear that in mind when we're drawing up the schedule. So thank you very much for your time. So now, Councillor Webb, you've moved us on to discussing sorry, Councillor Mason, I'm terribly sorry.
That's all right. I suppose, in Councillor Webb's vein about trying to be pragmatic and move us on. But we're lucky, I suppose, in the sense that we've got 3 months after our next meeting. Maybe it seems wise, well, we've got the officers here, because obviously just with Peter's extra suggestions puts us into kind of huge amounts of items. If we try and nail down what we actually want to do in July, because the officers will know pragmatically what can actually get there, it's a month away. And then I suppose between now and then, Democratic Services come back, having reviewed all the constitution and the last committees, and what has to come here, what doesn't have to come here. We maybe have some way online of rag rating what we think is a briefing, and try and collate all that information. But I think now I'll focus on July, because otherwise I think we'll talk about all of this and then, yeah, not really move us on to actually getting the core of the next meeting, which is a month away.
I think it's the work plan for the next year. It's
No,
not.
I know that's the job now, but
Yes.
I don't think you're going to be able to produce a work plan for the next year from this conversation. I think it needs more than that. So I think for me, my suggestion would be we focus on the next meeting's work plan on the basis that between now and then some work's going in the background that then shapes a discussion that actually we know when things need to come, what needs to come, what we think we could take as a briefing. I think trying to get however many members to agree a year's agenda without some of those bits of information is a huge task.
Yes, I don't think we're not going for a timescale now. We're just trying to find out what we think would be good to come to the committee.
So we're just adding to this list then?
Sorry?
So we just add to this list?
We can either add to this list, you can comment if you don't think it's suitable to be on this list. We get the whole point of having these meetings as well in public so that we could debate this so that the citizens of York can see what we're going to do.
So
what we're talking about.
So how do we get to what's on July's agenda with that, which is a month away? And we could add loads of things to this list tonight, but how do we make that possible in a month?
From the notes here, and from what I suggested, adult social care strategy update will be ready for the July meeting. Also, as Peter was saying, the urgent care update is will be also ready for July. So those two topics, which are in the public health sector, would be both suitable to come and ready to come to the July meeting. Unless you have,
No, I just think, I mean, I could add loads and loads and loads to every single area, but I think the idea is we've already got 20 odd things on a work plan. How are we going to try and make that work?
Well, we're going to move on from public health, which is what we discussed with Peter.
Okay.
And now we're going to move on to education, health and housing. So, the night is but young yet. So let's.
If we think that's the most efficient way to do it, fine. But I just think it's a long process to not get to a position where it might work.
We're here to sort of discuss everything that's on the work plan. Okay. Anybody else got anybody? Martin.
I'm not sure it's going to be helpful or unhelpful, but certainly all of those things that Councillor Webb has talked through, how they come, when they come as a briefing, I think is for you to decide. I can certainly put some dates beside all of them. Some of them have some crucial dates. So for July, the SEND strategy is something that we would want to see here, not as a finished document, but something that we would helpfully consult you about as part of its journey. I've got a list of the other things that, if it's helpful to put some dates, certainly some reports like the Children's Safeguarding Annual Scrutiny report, Scrutiny report, which I think it is helpful to have some debate with the Scrutiny. The Scrutiny is there to test out whether the partnership for safeguarding children in York is a healthy partnership and whether that partnership is working. She writes an annual report, and it's an opportunity for you to have some depth of discussion with the Scrutiny, who's independent, to test out whether we are providing a good service for children in the city. But again, she will write that report at a certain part of the year, so it will dictate when it needs to be here, because it's got a whole range of other places to go. So if it's helpful, I can put dates or I can put months alongside all of the reports for children. And then I guess it's up to you to decide what you want in terms of whether it's a full report, whether it's a briefing, whichever form it comes.
Thank you. That will be helpful. Not necessarily, we're not going to set the whole work plan for the year and give dates this evening, but we are going to decide what is and isn't appropriate, or if there are more things, of course, that people want to discuss. So, Guy, you would like to have a word with?
Thank you, Chair. I think it's probably fair to say there will need to be at some point some element of prioritisation. We do have a limited number of meetings, so that there will need to be that kind of discussion. Just in terms of the briefing sessions, I think it's probably important to point out that it doesn't need to be quite rigid and fixed in terms of its approach. So the briefing session could take the format of an online session, it could be an in-person session, it could be the exec member or the officer presenting. It could be a recorded presentation that's sent out to members, so it can take many different forms. So please don't think it needs to be a really rigid structure in place. It's there to inform members and decide whether there are particular areas that need to be particular areas of scrutiny that need to be undertaken in greater detail. Thank you.
Okay. Thank you. So, Councillor Webb, you were on the way to move us on to education, which was no bad thing. So would you like to go through?
Yeah, I mean, I've already given my directions, and council, well, it is obviously it's your committee to debate it, but I've sort of made my points, and I think on the what Mike said about the Children's Safeguarding Partnership annual report, the independent scrutineer, my view was that would make a really good briefing session where that independent scrutineer could come along and do that. Because essentially in the past, they've come to scrutiny. I don't think they'd mind coming to something different, however that works, whether it was face-to-face or online or whatever. I made my points earlier. The only one that I didn't mention, that I've just sort of remembered, is I think something that would make an interesting task and finish group would be York Youth Council. So York Youth Council exists, and there's some really, really active young people on that group. And for me, I think it'd be really interesting to sort of see how York Youth Council fits in with the rest of the City of York Council, or potentially how it doesn't. And so it's just an open question, really. I've not got any particular answers, direction, or anything like that, but it's just been something over the last couple of years. It's one where, from my position, I've been along to their meetings. I think they are frustrated that they don't necessarily see their voice. I thought, given it seemed like quite a nice cross-party task and finish group item. So that was the only other thing I wanted to add.
Councillor Munsterman.
Yeah, having been to York Youth Council in the past, they would appreciate us looking at them. And I think a task and finish group is a very good idea. It's quite motivating to have councillors turning up and talking to those young people. They're very bright and intelligent and engaging, aren't they? Yeah. And I think that our interest in them would be a very good thing.
And to perhaps to encourage more people to a more cross-section of the community, school community in York to join on to those to the committee here.
Really sorry, Chair, I want to come back. I want to just pick up the safeguarding thing. Safeguarding is not a good thing to put into public, because what you usually find is some slightly sensational reporting of what's happening. To put it in a private briefing means that councillors will know what's going on, whether it's adults or children, because they both produce an annual report, and questions can be asked privately without thinking it's going to suddenly appear in the paper the next day.
Mm-hmm. Thank you. That's a very good point. Councillor Clark.
Thanks, Chair. Just following on from Councillor Munsterman's point, I think that's part of what we were saying, I think, earlier, is about having those briefing sessions. If there's something that comes out, particularly out of the safeguarding briefing, as Martin has said, that we need to look at to see if that is a good service that we're offering. Perhaps that is the thing that should come to scrutiny rather than the actual presentation of the report itself. And that's all I was going to add.
Thank you. Thank you. This is all really valuable to for the development of this this committee. Councillor Nichols.
Question for Councillor Webb. Where does free school meals come in? Or have I just missed it onto another committee?
No, I was kind of waiting for someone to ask us that question, Councillor Nichols. If you remember in the Children's Scrutiny Committee, we received what I thought was a really sort of quite excellent briefing that was sort of a partial year's research. That was in November. It was November the 5th. That research has now been completed. It is available, and again, I'm very willing to be led by the committee how we put that together for you guys, if that was something you were minded, whether that was a briefing or whether it was public. I freely admit, you know, it's a big part of what we're doing at the council, so I think that might obviously influence your decision about where you would want it, whether it was a briefing or public scrutiny. So yeah, so I kind of leave that up to you. That makes sense for it to come to this committee because it's all about people.
Great, thank you for that. So moving through this, we've looked at the York Learning Annual Update. We haven't looked at the Neighbourhood Policing Review at all. I don't know whose remit that comes under. Is that yours, Pauline?
It's I'm now responsible for community safety, so I think in broad terms, but in terms of the community policing review, in the police officer that attended last time was going to let you know, let Democratic Services know when that report would be available. So I think we need to make contact directly with them to assess when they're willing to come back. Do you want me to just summarise some of the reports that I picked out from the list?
Yes, that would be helpful.
Round officers.
Yeah. Yeah.
I will try and help with timing if that helps as well.
Yeah.
So the York Learning Annual Update would normally come at this time of year. It's not quite ready, so that would be ideal for the October meeting. It is required by Ofsted, so we'll need to come back at some time.
Yeah.
Neighbourhood policing review, as I've said, if that we'll make contact with the police to see when that's ready and when they can attend. Neighbourhood model update. We were hoping to bring that in July. Originally was scheduled for around July under the previous structure, ahead of community consultation that's going to, engagement and co-production that's going to take place this summer, which will feed into an executive report in the autumn. And there'd be another opportunity for pre-scrutiny ahead of that report. But we thought it'd be really useful to give you an update as to where we are on key elements, not least the outcomes framework that Scrutiny recommended we develop. So again, Scrutiny's input into that ahead of that engagement in the summer. So I know your July meeting sounds like it's quickly filling up.
We don't have to stick to, you know, we could, if you feel that is an item that you need to have looked at in July, and the committee, you know, this is what we're here to kind of debate as well. Once we've heard from all of you what you think is important, and then what we can, you know, whittle down is not quite the right word, but what we then can work into the timetable.
So I would recommend that
you would
it
go
would be
for
timely for it to come back.
So that's the neighbourhood model update.
Yes.
Yes, for July. And that would be ready, definitely ready by the 9th of July.
Yes.
Yeah.
Yes, it would be a presentation.
Okay, just one moment. So Councillor Cuthberts.
Thank you. Sorry, I don't know if you've finished yet, Pauline, but I was just going to ask when was the date of this neighbourhood policing review? I thought you mentioned it.
We haven't got, I understand the report is available. It's whether the police are available for future meetings.
The report is available.
But it's the availability of the police officer to represent it.
Right. Thank you.
So the next couple I've got is in relation to housing, supported housing around learning disabilities, the Glen and Lowfields. I'm not aware of the context and the detail behind that, but certainly what I'm proposing, I'll just come to proposals on housing in a second, if that's okay, for you to think about. And then there was another in there around relevant outputs from the LGA peer review around housing partners. Again, I've had a look at the peer review report and can't quite identify what that was, so I'd welcome any feedback on that. But since then, in April 2024, we've been subject to housing regulation and the housing regulator consumer standards that the previous scrutiny committees have heard about. We've produced an annual report for executive recently, and it would be very useful to have scrutiny of our progress against that mid-year ahead of another annual report in a year's time. And that covers all of our landlord functions, including building services and the tenancy management of our social housing stock in York. So that is one that's not currently on your list. And then one in which we could talk about the learning disabilities provision is the housing development programme. So that would be the whole remit of our development work in the city, our new developments, which are a range of...
What sort of developments was that?
So these are where we're building council houses, but also working with other developers across the city to develop social housing and affordable housing.
Okay.
So those two areas, consumer standards and the housing development programme, are additional suggestions.
What about Housing First as well? Because that's launching next month.
So
we wondered about, I was thinking, don't know if anyone else had thought about this, maybe, I don't know, 6 months from the launch or a bit longer to bring some sort of scrutiny to see how that's getting on, because it's a very radical departure and a very exciting one, but it'd be good to know how it's working.
So that's the strategy that was approved before Christmas, which is the homelessness and rough sleeping strategy that Scrutiny input into. We've got formal launch of that in July, and a significant programme of work sitting behind that. So we absolutely welcome any scrutiny input to how that work is going.
Okay. Right. Anybody got any other ideas on housing or anything that they'd like to see around that? No. Okay. Thank you. Oh, sorry, Tony.
Thanks, Chair. Thanks, Ollie. Sorry, I'm going back slightly to the neighbourhood policing review, just in terms of the discussions that we've had about whether that is a briefing or it requires scrutiny, or can we influence that? Or is it really just lend itself to a briefing for members with questions to the officers when they're available, the police officers when they're available?
Okay, to respond to that, Chair.
Yeah, sure.
Yes, I think it's for information, and then you decide whether there's some elements of that you want to take.
Okay, thank you. Councillor Mason.
Thanks. Assisted gardening would be something I'd be interested to look at in terms of what support residents can get to manage their properties.
Sorry, I can't hear you. I'm really...
Assisted gardening.
Gardening, assisted gardening. Okay.
So people that are elderly, infirm, struggle to maintain bits of land or garden. There's been provision in the past from the council for that, and I know we've had issues accessing it or what's available now.
Okay, yeah, assisted gardening. I'd be all in favour of that. I didn't know about it. I thought I could do it myself. Okay. That comes under...
No idea, but it's the people element I was interested in.
Yeah.
And this is the problem, isn't it, with the people in place and buildings and space.
That's good. There was a housing annual survey, and it was more negative this year than we would have liked to have seen, I think. So I had thought about a task and finish group, but Guy has suggested that we don't have more than 2 task and finish groups. So we have to decide also what we want to look at with a task and finish group. But I'd also suggest that if people have a real passion for working on something in task and finish, because we have fewer meetings scheduled like this one, we do have time freed up so that we can work in task and finish groups to produce reports that we can then bring back to this committee, that we know, we look at things in depth, cross-party. And I personally was a member of I found it a really good experience to be on a cross-party task and finish group. That was really excellent, and I can only recommend that to members. It does require, you know, extra time coming in and meeting with people and meeting from various different organisations, but it was a very valuable experience to get a really in-depth knowledge. So that's something that we could maybe look at within housing, and look at you know, how happy are tenants with the repair service? Those sorts of things we can try and find out about these. So, any other questions on housing? And then I think we shall move on to finish on education, because I don't think we need officers to stay any longer than they need to. So nothing more. So thank you so much, Pauline, for your time. Thanks. So if you want to leave, please do. And we just have we promise we won't keep you much longer. We just want to make sure that we've gone through everything. Has anybody got any questions on the education side? Councillor Cuthbertson.
Thank you, Chair. This might not be directly along the lines that we've been discussing, but I'm wondering, we had at the end of the last children's scrutiny a list of things that were outstanding that could go on the work plan. I don't see those items in this list.
Are they not CCC? Sorry? Yes, please.
I did put, or I tried to put everything that was mentioned in the last Children, Culture and Communities scrutiny meeting into that work plan section. I didn't copy everything that was in the work plan over, just the things that were mentioned in that meeting to bring over to the committee.
So in the origin section, it's got CCC, Councillor Cuthbertson. I mean, because I wasn't a member of that committee, I didn't know.
I realise I'm just hoping that nothing falls through.
Yeah, no.
And I'm wondering if it might be worthwhile reviewing that list, just to make sure that if there is something worthwhile that we miss, we can include it.
Yes, okay. Councillor Nichols.
Yeah, I mean, the only thing I thought was the free school meals in the library as well. Other than that, I don't think there's anything massively. I don't think Reece missed anything out on, because obviously I wasn't at the last meeting, unfortunately. So, and Councillor Webb's covered the rest, so they're the bits that I would imagine we may include at the end. I'm going to bring them to, but that's it.
Okay, Councillor sorry, Pauline Suchfield, sorry.
The libraries is now under the place scrutiny.
I thought, yeah, I printed out a list of what we have quite a long list of what we're supposed to be doing, but sorry. So what were the items that you
The free school meals.
Okay, and we've mentioned free school meals, and the rest is on here. Okay. I don't think we need then the officers or even, I don't know if the executive members.
The only area that I would suggest linked to the Children's Wellbeing and Schools Bill is obviously the local authority will get some new duties around elective home education, and it's whether we want to, you know, you as scrutiny want to look at current and future arrangements around EHE. And also a very hot topic nationally is the local authority's Section 19 duties under the 1996 Education Act, which are for children and young people who are unable to attend school due to illness, exclusions and other reasons. It is a big hot topic nationally, and most local authorities at the moment are reviewing their arrangements in that space.
So that would be something that we could think of. I think there's also, is it York Hungry Minds, Councillor Webb?
Yeah, so I think I assume that's what Councillor Nichols was referring to when he talks about free school meals, and obviously the absolutely excellent work that we've been doing around that sphere, both through the council stuff and through York Hungry Minds. So I think that comes as one item. Just following on from what Maxine's just said about those young people who are struggling to attend school for a number of different reasons. That for me is the attendance item. And I really do think at the moment it's such a big issue, and there's so many, by that I mean there's so many different aspects to it. I would recommend a briefing on it first, so that maybe you can then actually focus down on what it is you actually want to discuss and maybe bring as future policy ideas. That's my thoughts around that. Yeah, thank you.
When do you think a report would be ready on a briefing report on around that?
Certainly bring one to.
Because it wouldn't necessarily be to a meeting.
Not to a meeting.
Yes.
We can be directed by Scrutiny on that if when it's suitable for you to receive a report.
When are we talking about sometime in September, or is that too early?
Fine.
Is that yeah?
Yeah.
Councillor Webb.
Yeah, if Maxine's happy with that, then that makes sense. But just the one sort of caveat that I want to sort of make sort of on officers' behalf is just for Scrutiny to be aware of workloads.
Yeah.
And so there's, the SEND stuff, which we need to make sure we get right. There is, potential for inspections, for example, around that area, that part of the year. So, again, it's entirely up to you guys, but just have that in the back of your minds, that asking for loads and loads of things at one particular point can be challenging. So just
no, that's why I was asking.
Yeah, thank you. Yeah.
What I don't want to do is what I said earlier is, I know on other committees, some people have been pressing for things to and why isn't this ready? And it's because they don't have the manpower. We don't want to, we're about people. We don't want to make people ill by demanding them, we will have that report by this date. I think it's better to, and you get a better report. So if September isn't feasible, please say, and it may be that then you will be invited back to the meeting. It's going to be a lot like an ongoing organic process. This is what I've gleaned as well from going to meetings of chairs and vice chairs of the Scrutiny Committee, and I will work, of course, with Councillor Waller. We had an unfortunate mishap and miscommunication, so we haven't managed to meet yet, but we certainly will, perhaps this week or next week, because we can work together to work out a timetable for all these things. What we needed to do tonight was to gather information as a group and hear from officers and directors to find out what they think is important and what we think is important. And I think we've done a really good job in actually quite a short amount of time of thrashing things out and finding out what we want and adding things as well. I think assisted gardening is a really good thing. I noticed the thing that, and I forgot to say to Peter Roderick about the AI. I think that came from Councillor Vassie and the robotics element of adult social care, because we went for a very successful site visit to Flexman Avenue and saw the working home that they have there, and it was an absolute revelation of the things on offer that the council can provide to people. And it's an example of us going out and doing something a bit different than sitting around this table and chewing things over. So anyway, if officers, if you'd like to to go, please feel free to do so. Now, because I think we can maybe get into the nitty-gritty of talking about the next meeting now that we've looked at the full picture, if that's okay with everybody. Has anybody any members got any ideas then? What would we like to do in July? Councillor Runson,
Is that other than the two we've already got?
well, those are not
I
set in
think, I mean, I'm sure.
Thank you very much for coming along.
I'm sure we can take Guy's advice on this, but we mustn't have meetings that are too long.
No.
With too many things on the agenda.
Exactly.
And we've got two fairly substantial ones. We've got the adult social care strategy and urgent care. Now, whether you think something else should go in or we stick with those two, I'll leave for your discussion.
Or do we want to have the something else? I think there was the neighbourhood model update as well might be available. What do we see as a priority as a group? Sorry, Councillor Webb.
Yeah, from a decision-making point of view, the SEND strategy has to go there in that July meeting, and therefore, my thoughts are you've got the item that was suggested earlier, the adults item, and the SEND strategy. I don't think you'd want anything else really.
Okay, Councillor Clark.
So yeah, just to bang the drum for the neighbourhood model, because we've already discussed that, and that's important that it comes to the July meeting as well for pre-scrutiny, pre-decision. Is that right? Yeah.
Yeah. So rather than the adult social care and the urgent care update, we could put those back to October or even further back. But initially, I think then we're looking at the SEND item, which, yeah, it's imminent and needed. Councillor Nichols.
Yeah, I agree those two, because I remember like the neighbourhood model is massively important, but I think it's going back to what Guy said earlier, is that if there's a feel that they need to put their reports in, they can still put them in a way that isn't taking up our time, that we will just at that meeting say, well, I'm going to put these questions in. So, you know, I think this is where the office has got to guide us a little bit to this new way of working.
Yeah.
And picking up the point you made earlier,
Thank you very much.
Burton, is that the chairs and vice chairs meeting, when we met last week, was caught out by the fact there was a meeting today, because decisions are going to be made, but they're not going to be made till after this meeting. So I think we're having to just put an idea together. I think these two items are massively important, but I think everything else, I think, needs to follow. We're going to have to leave it to you and Councillor Waller's trust that when those decisions are made, and say, well, actually, those two things can come, but they're going to come in this way.
Yes.
And we'll just have to accept that.
Yes.
And so be it.
Yeah. Councillor Moroney. Thank you.
Personally, I think urgent care would be an extremely good example of asking the organisation to submit a report. And then we prepare ourselves to then interrogate. Thank you.
Yeah. I remember that being an important point. Councillor Clark, are you wanting to speak? No, oh, you look like you're poised. It's a premonition. So we've got a completely different July meeting now. If that's okay with everybody, does everybody feel happy with that? Councillor Clark, yes. Right. It was premonition, you see.
Probably it was a bit. Could you just clarify the two items that you think we're discussing in July, please? Because it seems to have got a bit.
It's the SEND report and the neighbourhood model update. Is that okay with everybody? Councillor Mason.
I'm not sure exactly what the SEND report covers, but I'd be interested if it can cover kind of boundary issues. So I know, for example, we had somebody who had a forget what the current word is. I'm going to say statement, but educational healthcare plan.
ECHR.
Yeah,
yeah.
And there was boundary issues about where peer groups were going to which schools and how that affected them accessing specialist education. So something around that would be really interesting.
But we could include that hopefully in that, yes, because and I think things are really going to be changing in that area. I think there's a report by the Sutton Trust. I think you mentioned, was that on this? No.
On the special educational needs?
Yeah.
No, that was about poverty and inclusion.
Oh,
And I think
okay.
that there's an item around that, but that'll be sort of later in the year when we're talking about attendance and
Okay,
support around that.
yeah. Certainly.
Thank you, Chair. Just in terms of the in-depth pieces of work to undertake, I think one of the things that we'll need to do as a committee is put together some terms of reference. I think that's really important in terms of establishing that focus, and the discussion that we have with the officers and the executive members can help inform how we're going to focus our scrutiny work, because ultimately what we want to do is make sure we have the biggest impact, because we're going to come up with some recommendations. So those discussions with the exec members and with officers, I think will help inform that. The other thing I want to just very quickly add was I wouldn't worry too much about if there were little gaps across the course of the municipal year, because actually having some scope for emerging work, and especially with children's services, is really, really important. So I wouldn't lose sight of that. I think that's quite important. And then the point about two in-depth pieces of work. I think with the kind of the logic around this would be, if we were to undertake too many reviews, that we wouldn't do it justice. And my kind of thinking is that I think focusing it on potentially 2 reviews, you're going to have a kind of maximum impact by doing that, rather than 4 or 5 reviews where it's going to be difficult to complete that level of work over the course of a municipal year. Thank you.
When you talk about reviews, so you're talking as task and finish.
Task and finish.
Yes, so task and finish are now reviews, but is that where you've come from?
Same thing, yeah.
Yes.
Sorry.
But no, it's okay. We want to make sure we're talking the same language here. Yeah. So I think if people can think about what task and finish things that interest them, that will be really helpful. You don't necessarily have to come up with anything today. Has this been helpful for members? We're really at the beginning of a process, and it's a learning process for all of us. I mean, there are things that I'm learning from Guy as the Democratic Services Manager, and we're all sort of here learning how this goes along. And Councillor Waller and I will definitely meet up as soon as we can, and that he's available. So, going back to the agenda, she's worried into some of my papers. I'm really good at this. What's the agenda? I don't think there's any other business.
Sorry.
Right?
I just one thing.
Oh, absolutely.
Just for councillor, was you thinking of bringing the same people back to present because we had them from the 2 universities, didn't we? Gave their reports and their studies. Was you thinking of getting them back in person again? Or was it just what their findings were?
I will be directed by the committee, but I've met with the people who finished those reports off. They were very happy to talk about it, as you can imagine. It's really good for them and for the work they've done. So if that was what you were minded to do, I felt it worked quite well last time. So yeah, I'll be directed by you as to what you're thinking. Councillor Burton, if you want us to have a chat about what form that took previously, then I'm sure.
Yeah, and obviously Councillor Waller was there when they came, so he knows that how good they were.
Yeah,
given their evidence.
And just again on the task and finish reviews, I do think youth council and maybe youth voice within council is certainly something. And as I say, I'm completely open about this. So if people want to have a think about what questions they want to ask around that topic, please do. But I do think it would be genuinely helpful for us as an organisation, and I think it's something that cross-party we could do well.
Thank you. Councillor Mason.
Yeah, I think Councillor Webb's right. There's a huge lack of any kind of strategy for the youth council, and there has been for the last 11 years I've been on the council, and frustrating for them and frustrating for us, I suppose, because it's our only easy opportunity to get into that, space in terms of having regular contact with young people that are really passionate. So I think it's a great idea as a task and finish group.
Thank you for that. Anybody else? Okay, so there's no urgent business, so I call this meeting to a close. Thank you so much, everybody.